Contrary to popular belief, you don't have to take your thyroid medication first thing in the morning. I know a lot of you are probably getting ready to throw your bottle of thyroid medication at me for even suggesting such a thing, but it is true. The truth is that there is nothing magical about taking thyroid medication in the morning. But if you were to ask your doctor or your pharmacist when you should take it, they would try to tell you that the only time that you can take it is first thing in the morning. We have studies like this one though, which prove that this isn't the case. This study looked at 152 drug-naive thyroid patients and put them into two different groups. By the way, someone who is drug naive is just a thyroid patient who has never taken thyroid medication before. Another point worth mentioning about this study is that all the patients who were tested here had the diagnosis of Hashimoto's thyroiditis. So back to the study. The first group of thyroid patients was told to take their thyroid medication 30 minutes before breakfast, and the other group was told to take their thyroid medication 2 hours after dinner. The researchers then tested the TSH level of both groups of patients at various intervals over the course of 12 weeks. Do you know what they found? They found that both groups of patients saw improvements in their thyroid symptoms, an improvement in their cholesterol levels, an improvement in their quality of life, and they found that both groups of patients required roughly the same amount of medication to normalize their thyroid lab tests. In other words, regardless of the time of day that thyroid medication was taken, both groups of patients saw roughly the same benefits. Now, there are some limitations in the study that are worth pointing out because it's not perfectly designed. One limitation is the number of patients, which was only about 70 in each group, which isn't a huge sample size. The second is that the first group of patients were told to take their thyroid medication 30 minutes before food, and the second group was told to take their medication 2 hours after dinner. So there is some discrepancy in terms of when both groups of thyroid patients were told to take their thyroid medication. And lastly, there's no way to know for sure that all of the patients in this study actually followed directions and took their medication every day. Despite all of these limitations, there's still solid evidence, even in the form of additional studies, which suggest the same thing. It doesn't really matter what time of day that you take your thyroid medication. What does matter is that you get your thyroid medication in every single day at roughly the same time and on an empty stomach. Why do the results of this study even matter? Because not every single thyroid patient has a schedule that allows them to perfectly take their thyroid medication first thing in the morning. People often live very busy lives. And when you take into account the fact that thyroid medication must be taken on an empty stomach, it can make fitting your thyroid medication into your schedule very difficult. But this doesn't have to be an issue because studies like the one we just discussed show that it's viable to take your thyroid medication at virtually any time of the day. Even though this is the case, you will still probably find that your doctor recommends that you take your thyroid medication in the morning for a few reasons. The first has to do with something called Dogma. Dogma just refers to a set of principles that have existed for a long time. And these principles are often just accepted as being true, even though they really have never been challenged. I bet if you were to challenge your doctor on what time of day is best to take thyroid medication, they really wouldn't have a good answer for you. The main reason it's recommended this way is just because it's always been recommended this way. But this isn't really a good excuse, especially when we have evidence to suggest that this claim is incorrect. If your doctor does have a response to your question, it will probably be something like this. Well, you have to take your thyroid medication first thing in the morning because that's when your stomach is empty. And while it's definitely true that thyroid medication does need to be taken on an empty stomach, there are plenty of times throughout the day that your stomach is empty. So this still isn't a reason that your thyroid medication must be taken first thing in the morning. For those wondering, here's how the physiology of the stomach works. In an otherwise healthy adult, it takes approximately 2 to 4 hours for the food that you have eaten to exit your stomach and enter your small intestines. So from the perspective of thyroid medication, as long as you take your thyroid medication at least 2 hours away from your last meal, then you can rest assured that your stomach is actually empty and the food that would have been in there isn't going to interfere with your thyroid medication. So the take home here is that you can pretty much take your thyroid medication at any time during the day as long as it's about 2 hours away from the last time you had food, and at least 30 to 60 minutes away from other supplements and other medication. But is it safe to take your thyroid medication in the evening? I can probably already guess what your next few objections are going to be to this idea. So let me try to address them before you even get the chance to voice them. The first biggest objection I hear whenever I say that you can take thyroid medication in the evening has to do with sleep. Thyroid patients will say something like this: "But what about my sleep? Won't taking thyroid medication in the evening interfere with my ability to go to bed?" And the answer to that question is most likely not. Most thyroid patients who take their thyroid medication in the evening have no issues falling asleep. Having said that, there is a small chance that it might cause issues. But you can kind of predict how you will respond to taking your thyroid medication in the evening by looking back at how you react to taking your thyroid medication in the morning. If you are like most thyroid patients, then you probably do not find your thyroid medication to be very stimulating. It's not as if most thyroid patients receive a big boost of energy right after taking their thyroid medication in the morning. It does for some people, but not for most. If you are somebody who doesn't really notice a big difference in how you feel after you take your thyroid medication first thing in the morning, then taking it in the evening will probably not cause you any issues. But if you are somebody who does notice a big boost in energy or the sensation of a rush when you take your thyroid medication, then you might be somebody who does experience issues with sleep if you were to take it in the evening. The next objection I hear is something like this. Well, it may be the case that somebody taking a weak thyroid medication like levothyroxine can take their thyroid medication in the evening, but this will never work for me because I take T3. And just like my response above, it's very unusual for thyroid patients taking T3 to experience issues with sleep, even if they take that T3 right before bed. Are T3 thyroid medications slightly more likely to cause issues with sleep compared to T4 medications like levothyroxine? Yes, but the percentages are still in your favor that they won't cause any issues. How do I know? Because when I was practicing and prescribing T3 thyroid medication, my default would be to recommend taking it right before bed, late at night. And based on my personal experience prescribing it to hundreds of people, only about 5 to 15% of people or so had issues with sleep, even if they took it right before going to bed. So this strategy of taking thyroid medication in the evening works for all types of thyroid medications and all formulas. Whether or not it works for you is more about your own personal genetics and not what type of thyroid medication or what dose of thyroid medication you're taking. If you're interested in this, let's talk about how to transition from taking your thyroid medication in the morning to taking it in the evening. One of the best things about changing the time of day that you take your thyroid medication is that this is something that you have complete control over. You can't force your doctor to prescribe a certain type or dose of thyroid medication, but you can adjust when you take it. And making even a small adjustment to when you take it can have a big impact on how it makes you feel. So if you are somebody who wants to transition from taking your thyroid medication first thing in the morning to late in the evening, here's how to do it. Option number 1 is what I call the skip dose approach. When using this approach, what you would do is take your thyroid medication normally first thing in the morning. You would then skip your next dose the following morning and start it back up on that evening. So if you took your thyroid medication first thing Monday morning, your next dose would be Tuesday evening. And then from there, you just continue taking it every single night. Option number 2 is called the non-skip dose approach. With this approach, you would take your morning dose of thyroid medication and then take another dose on the evening of the same day. So if you took your first dose Monday morning, your next dose would be Monday evening. And then from there, you would just continue taking it every evening. Both of these options can work, but I would recommend using the skip dose approach if you are someone that tends to be more sensitive to even small changes in thyroid medication dosing. Most people shouldn't have any issues taking their dose of medication first thing in the morning and then again later that same evening. If there's any question about how you should take your thyroid medication, make sure you touch base with your doctor. I'm not giving you medical advice here, I'm just giving you some general guidelines that I know that have worked for other patients. The next question you might ask is what happens if you take your thyroid medication in the evening and it doesn't work for you? The answer to that is simple. You just go back to taking it in the morning. You won't have done any harm in the process and you have learned a lot along the way. In terms of side effects, the most common reason that patients can't take their thyroid medication in the evening has to do with interference with sleep. Some people have also reported some strange dreams or unpleasant dreams as well, so be on the lookout for those. Aside from changing the time of day that you take your thyroid medication, there are a lot of different ways that you can make your thyroid medication work more effectively, aside from just changing the time of day that you take it. And if you want to learn some more tips and tricks on how to make your thyroid medication more effective, I'd recommend checking out this video next.